Hey, 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 everybody. Happy Friday. This is Blake with the Association for Vascular Access, and we're continuing our AVAS Scientific Meeting 2022 Speaker Showcase series. So, with me today, I have Karen Mueller and I have Amy Rissler, both presenting. You guys are presenting together one of the sessions at conference. So, we're really excited to have you on the show today. Give everyone a little rundown. Like, what's your background? Tell us a little. If I didn't know you, how would I learn a little bit about you guys? So, give us a quick intro.
Awesome. I'll start. Kara Mueller, my education is registered nurse. Then I got a little frustrated, as I think most do frontline, about how cost drives care. That as much as we want to do some things, the money often limits what we want to do. So I went to the other side of healthcare into the medical device industry. And I have been fortunate enough to launch very revolutionary medical devices that change clinical outcomes. It's a hard mountain to climb, but it can be done if you persevere and you address both clinical and financial. I am now in the vascular access space coming from wound care, which actually have a lot of elements that are the same. And I've been living inside of a catheter for 9 years, trying to really understand why these problems happen and really focused on the microorganism side, not realizing that microorganisms lead to biofilm, which lead to infections and occlusions. So lots of really cool information. I'm a wannabe nerd, so I've really enjoyed taking this on. Started and founded my own company, Sterile Care. So although I wear that hat, I probably lead with my nursing heart first. And then last, I personally am very proud of my biggest accomplishment as a mother of 4 girls. They keep me busy on the side.
I bet they do.
Maybe?
Awesome. Well,
Just a
welcome,
little
Karen.
busy.
Welcome to the Nerd Club.
Yeah, exactly.
And Amy, tell us a little bit about yourself.
Well, I am a fellow nerd as well, and I have embraced that role in my life. So I'm a nurse myself, have been a nurse for 30 years. I've practiced clinically in the areas of hematology, oncology, infusion therapy, and then vascular access. So my whole life has been about these devices and honestly pivoting toward mitigation of the risk of complications, as I know a lot of us in this space are really challenged with mitigating the risk for sometimes the most vulnerable patients that we deal with, and even those that we don't think are vulnerable sometimes become the vulnerable ones. So, like Karen, I just have a huge heart for the patients that we serve and their families, and trying to keep them out of harm's way. Um, so I think that, I love the theme of the conference this year, educate the clinician, protect the patient. So for me, that means, educating clinicians on, not only, is your line occluded, did the patient get an infection, but taking a deeper dive into how did that happen in a more granular level? What are the things that we do to intervene to mitigate the risk so we don't have to deal with it? One thing that has impressed me over my career is how sometimes we just become in the mindset of that complications are inevitable. And along with many of you, I really seek to try to understand how we can change our mindset to the fact that we can prevent these things. We can protect our patients, the vulnerable, the what we think are not so vulnerable, by saving the line that really is the most essential to them in treating their disease states. They need us. They need us to step up. I'm from industry as well, even though I've said I was a clinician for a number of years at the bedside. But I do focus heavily on the education aspect of clinicians and helping them understand not only the complications, but how they happen. So I'm very fortunate to be in that role and to be able to rub elbows with a lot of other clinical educators who are always thinking the same things. How can we support the clinicians that we serve so they can support the patients that we serve?
I think that's a fantastic segue into so tell us a little bit about your conference presentation. So a little teaser for our audience. They're going to come and they really want to see your talk. So what are you guys talking about?
So we're talking about the catheter from the inside out. So I think we often get caught up in looking at minute aspects of the whole big picture. And Amy and I both thought that that would be a great opportunity to step back and talk about everything that's happening, because really they are all interrelated. So we have to understand the big picture in order to understand how to solve issues minutely. As new technology comes out, it focuses on one item, but how does it impact that overall picture that we're looking at? And I think also because Amy and I both have a clinical background and have gone into industry, we are given the opportunity to really dive into the science. Whereas a clinician, you don't have time to do that, right? So you rely on us, you tell us what the problem is, we go out and we try and solve it. So we're able to dig really deep into the science. I'm telling you, inside of the catheter, I hear this new voice of, how do we get vascular access as a, individual certification that's a specialty on its own, because it is so complex. Just looking at the inside of the catheter, how do you really learn all of those things? And I think clinically, you have to rely on industry to go out, look at all of those things and hand it back to you so that you can decide what's best to do with your patient in front of you. So again, vascular access is a very diverse specialty. Rely on us to deliver that information. And I think this presentation is a really good overview of what's happening on the outside of that catheter and what's happening on the inside of that catheter.
That's awesome. Amy, any additional comments you want to throw at that?
Yeah, I mean, I think in line with what I was saying before, not just understanding what's going on, but to have participants walk away with some tools, things that they can think about and discuss with their managers, their administrators. How can we address these things? So, sometimes I think a good presentation means that you walk away with a lot of questions, maybe not all the answers that you need for your specific care setting. But to me, that is a successful presentation. If you guys look at this and say, okay, now I know the right things to at least open up conversations to my leadership, or to start looking at where we have complications and why. So to me, I hope it is putting more tools in your toolbox as a clinician.
That's awesome. I loved the whole concept when we were talking in the green room before the show, was like seeing the forest through the trees. And I love how you guys unpackaged this whole concept of this interrelated problem and how the different components need to be addressed. But the big picture is, the patient outcomes and the complications that we're seeing. So I am really excited about seeing you guys speak at conference. This is going to be awesome. And for those of us joining today, if you haven't had an opportunity to look at the full list of speakers for conference this year, go check out our website. I put a link down in the description that you'll be able to see. Check us out if you haven't registered. We're under 45 days now from conference. So it's looming, it's coming close, and we're really excited. So we got a couple more speakers coming up towards the conference starting from our speaker showcase. So definitely stay tuned. Karen and Amy, thank you for joining me today to give our audience a little taste of what to expect from your presentation at conference. And I hope you choose them. There's so many great speakers, and I'm excited. This is definitely one that I'm going to want to listen in on. So any final comments, any final words from you guys? So
just excited to be there. Can't wait.
Awesome. Well, thank you both for tuning in and joining us for this presentation, and I'm going to take us out. So,
okay. Bye, everybody.
Hey, guys. Well, thanks for joining us again on Friday for our Facebook Live event. If you're a big YouTube fan like myself, you can check out the post there as well. Of course, get the latest and greatest information, what's happening at the Association for Vascular Access. You can follow us, like us, subscribe, Facebook, Instagram, LinkedIn, and Twitter. Happy Friday. Have a great weekend, and we'll catch you on the next one. Bye, guys.